How can you tell whether your child is responding adequately to a trial of medication? It is such an important question to ask because the expectations that we have sometimes are a self-fulfilling prophecy. How do you know whether your child's medication is doing the job that it's meant to do? Reliable tracking mechanisms and recognizing the symptoms and the changes that are expected before your child starts medication, having the right diagnosis makes a huge difference. And then being able to fine-tune the symptoms and fine-tune medication to find the ideal match for your child. Every child is unique. So how can you tell whether your child's medication is working? It is a common and understandable question, especially for those children who are newly diagnosed, to gauge whether the medication is working, and as well as whether in fact it requires manipulation and also feedback and ongoing communication between your child's teacher, yourself, and the prescribing doctor. So if there is a breakdown in that communication, you won't know. It's important to talk communication, keep those channels of communication open. And how can you tell whether those adjustments need to be made and targets? The following two questions will help you and your child's teacher know whether in fact your child is on the ideal and effective dose of medication. What are you expecting from the medication? So important to create the right expectation. The medication is not liquid knowledge. Your child's not suddenly going to start spelling and reading and doing all those amazing things. The medication helps unlock what your child has. Remember, ADHD is not a knowing, it's a doing problem. So it helps the doing. With time, the knowing, the maturity, the knowledge, the academic benefits will become more evident. Of course, we all want to start off by giving a medication and feel it's like a magic wand. It's going to transform and do all those things that unfortunately create and need a lot of time and work. So what I would like to say is we need to target symptoms that can actually be measured before we start treating the medication. And that is important to think about and create the right expectations. So what I would say is the symptoms that are known to react and be treated and managed almost in the first couple of weeks, that distractibility, to be on task, to be less hyperreactive. Remember, children have lots and lots of concentration. They don't know what to concentrate on. The medication helps the focus and the control. Less procrastination, difficulty getting started, that inertia on boring tasks, being able to start and persist without that sort of force behind them, being pushed and panel beaten into getting things done. Less restless, less fidgety. A huge part of ADHD, which is unfortunately not described in the title of ADHD. It belittles ADHD, attention deficit hyperactivity. Included in that is that emotional lability and reactivity. The emotional reactions, impulsivity, tempers, outbursts, meltdowns. Those are the very important symptoms that really will determine your child's ability to make friends, interact. It will be able to help the family life, the school life, self-esteem, the positive feedback your child will get rather than that constant incoming negative, constant panel beated. And of course, children lose things less. And, what I think is important also to think about almost immediately, things like the attention to detail, to handwriting, the confidence that your child will get, being more in control of themselves. And now, how about the symptoms that are less likely to be influenced? Organization, sense of time, forgetfulness, and also just following rules. Those are things that come with time. A sense of time, that is part of the essence of ADHD. That inability to have foresight, hindsight, and also be present, to have that sense of the three things together, to learn from what happened, to be present and self-aware at the moment, and to look forward and to be able to make better decisions for the future. Are you seeing improvement in those target symptoms? Are you likely to be able to monitor, starting off in low doses? If there isn't initially an improvement on low doses, it needs to be titrated, increased. That is the skill of the doctor and the ability to be able to monitor the treatment. Stimulants, remember, are the first-line medications that we use. They work quickly. The non-stimulants take many months to start being effective. So it would be unrealistic to expect those symptoms to be effective immediately. Are other things like anxiety, mood disorders, medical problems managed? It is not necessarily a medication that needs to monitor allergies, sleeping problems, and to also make sure that there might be underlying anxiety that needs to be managed. If the anxiety is the major problem, that needs to be treated first. So creating the right expectation is vital. You know, the younger the child, the more observation is required from people around them. You can't ask a young child how they feel necessarily. An older adolescent child would be able to tell you immediately. You know, I feel more in charge. I can tell when it starts to work, when it wears off. I often ask those questions. Important to ask your child. They sometimes will tell you the answer that you least expect and that you most need. So, you know, what I would say as well is we use rating scales to also measure those things, objective measures. Parents see things from where you see things, different camera angles. Teachers see things from the other angle. We need to have a holistic, pooled source of information. And that's my job, is to be able to collate, put those pieces of puzzles into order. So it's communication. I have on my website rating scales that are there. They are comprehensive. They are there to be able to collect information conveniently online, independently from the teacher, as well as yourselves, to be able to, with time, monitor and adjust medication. So I hope that really helps put into perspective and make you think about what really goes into making the assessment of whether the medication is effective, and not to create, unfortunately, unrealistic expectations. I hope that helps.